Welcome back to Living 808. We want to age gracefully. We all do. And that starts with taking care of our skin. Kelly got some great tips from the pros.
It is Makeover Monday, and we're here at the Ferguson Clinic, but it's not all about surgeries when it comes to the Ferguson Clinic, even though, of course, we have our great Dr. John Ferguson.
It's a pleasure having y'all here today.
Yes, thank you for having us. Now, we know that you do so many great surgeries, but there are some really great things aesthetically that you can do that don't require it.
Sure. Most people will come in and they think, oh, I need surgery to address my face or laxity in the skin. But what's often overlooked is the actual skin itself. We can make it as tight as possible with surgery, but if it doesn't look good, it really is detrimental to the overall results of the procedures that we perform.
Of course, people do have the wide variety of issues when it comes to their skin. So what are different ways that you can address problems?
Well, a lot of it has to do with just the skin type. As you can know, our community has a huge amount of variability in the skin type. We really have to customize it to those individual patients. So something that you would do in somebody with Northern European heritage is going to be completely different than what you would do in somebody that's Pan-Pacific or has Eastern Asian genetics. The things that we like to do really go on a progression from minimally invasive skincare products to a little bit more invasive peels and everywhere in between.
Okay, wonderful. And what all can be treated?
A lot of the things that we can treat are the things that you see in the mirror. The texture of the skin, the tone of the skin. You can see discolorations, you can see enlarged pores. And those are kind of the things that we want to tackle to make it a nice, smooth, even skin.
And what are some of the treatments to tackle some of those?
Well, it ranges anywhere from skincare products, which nowadays are wonderful, and the things that you can get vary from facility to facility. You can get prescription strength products that you normally can't get in your normal spas. And these can cause fundamental changes in the skin itself. Other things that we can adjust for the tone are chemical peels. We have chemical peels that are specifically designed to even out the skin coloration and help with what we call dyschromias. Now, texture, such as large pores, different types of skin lesions that occur, we have other ways of treating those. Some of the skincare products do help out with those, but we can increase the improvement in scars with hydrofacials, which is basically like a facial but uses water. So it can help the size of pores look better. It can help the skin look more hydrated and basically just give it a nice glow.
Perfect.
You can actually tighten up the skin and adjust for the texture of the skin using microneedling devices that have little radio frequency energy that stimulates collagen production. So in addition to helping the texture and tone of the skin, it can actually even tighten the skin.
Incredible. And for facials and even microneedling, those are some that I've heard about, but what would you say are some of the newer procedures?
I think what we're really proud of is our newest device. One of the things that's often overlooked are hands. People look at their hands and they say, everything looks great, but my hands give me away. We actually just got a new device that's specifically for hands that does a little laser resurfacing on it to really improve the texture and the tone, as well as tighten up the skin to a certain extent. You don't want to tighten the skin up, obviously, in the hands all the way, otherwise you won't be able to make fits.
Right.
You got to be able to grab stuff. But some of those textural abnormalities, the discolorations, this really helps out with quite a bit.
Okay.
And it's something that's just been missing in the market out there.
Wonderful. And that's something that is so quick and easier, right? It's not something that's an invasive surgery.
No, not at all.
Okay, wonderful. So if you do have any skin insecurities or are hoping to maybe touch up a little something, Dr. John Ferguson, he'll likely have the device that can treat your problem. So for those who are wanting to find out more information, where can we go?
You can reach us on the web at thefergusonclinic.com or just give us a call for a free consultation.
Perfect. All right, I'm going to be giving you a call because with my melasma, when you're talking about evening the skin tone, that's definitely something I need to look into. And I know some of those procedures you mentioned would help out.
Absolutely.
Awesome. All right. And again, if you want to find out more information, we'll have the details on KH12.com under the Living 808 tab. All right, back over to the studio.
Well, funny that you're there and here. That's awesome. So they've got so many different products or machines that can help in so many different ways. I am curious, though, since you said it, what is melasma? That you have melasma? What is that?
So that's hyperpigmentation, and it's caused like by hormonal changes, and so typically people get it after they have babies. I think for me it was because I just didn't get enough sleep and kind of threw my body off. But it's when you have like, if I didn't have makeup on, you'd see I have like darker patches than normal. So it's just like uneven skin tone.
Oh, okay.
And so
it's actually skin tone. It's not like eczema or...
No, yeah. It's literally just the pigmentation. And so I have to be, that's why you'll always see me with a hat, because there are some like creams and, as he said, like treatments you could do. I've never done microneedling, but I've heard it works wonders on it. So I'm hoping to go try that out, because they do things like that.
Oh, so they do have something that could help.
Yeah, so that's why when he was like talking about all the discoloration, I was like, oh, I need to come to you. But the thing with melasma that's hard is right when the sun gets on your skin, there's a good chance it's just going to come right back. So you have to be, that's why I wear sunscreen every single day under my makeup, even if I don't go outdoors, because the sun doesn't like my skin these days.
We all know a little more about you now.
Yes. You know, I'm uglier under my makeup.
No, stop.
It's not too bad. It's just, you know, just like a slight insecurity. Well, a lot of us have it. It's fine.